It's a pleasure to join you with a sense of renewed hope and optimism as we start to turn the page on the COVID-19 pandemic. Since COVID-19 started, the SCL Health family of physicians, nurses, and associates have come together to urge our community members to remain strong and vigilant as they protect themselves, their families, and their neighbors from the worst health crisis we've seen in decades. We are grateful for all you have done as we all remain vigilant in the months ahead. The first COVID-19 vaccines have started to arrive in our SCL Health hospitals, and we have begun immunizing our caregivers in order to continue to serve you. In a year in which we have struggled on many fronts, the consistent reported effectiveness of the first COVID-19 vaccines is great news. I acknowledge, however, that simply because healthcare professionals, like myself, see the vaccine as a beneficial preventative measure, it doesn't mean that everyone sees it that way. The fact is, though, that vaccines are perhaps the greatest miracle of modern medicine. They have had a major role in eradicating diseases and extending the life expectancy of the population, thanks to the acceptance of the general public. And they will continue to help us if we let them. It's why we are here with you now. As your partner in health, our mission is you. We are here for your health and safety. We are here to be transparent about the science behind the vaccine. We're here with honest, no-spin facts. And most importantly, we are here to support the conversations you will have with your doctor by providing information you need to make an informed healthcare decision. There are still some unknowns about the vaccine, and I know one of the questions we are hearing is it safe? We want to arm you with the facts to answer that and other questions tonight, straight from some of our doctors and nurses. It is critical that no one overpromises the potential of a vaccine. It does not cure, it prevents. And until our communities have been broadly immunized, we will continue urging that you protect yourself and others from the virus by wearing a face mask, maintaining physical distancing, and washing your hands. These actions remain essential. St. John Paul II once said, "I plead with you, never ever give up on hope. Never doubt, never tire, and never become discouraged. Be not afraid." We will get through this together, and thank you for the opportunity to serve you. Now I'd like to introduce Megan Monkey, who will guide this program.
Thank you, Lydia, and hello everyone. My name is Megan Monkey with SCL Health. We are so grateful that you've joined us to learn more about the exciting developments in both the prevention and the vaccine for COVID-19. Yes, the first COVID-19 vaccine is here. You may be wondering, is it safe? Is it effective? When will I be able to get the vaccine? Over the next 30 minutes, members of our SCL Health medical team will provide clear and easy to understand, down-to-earth answers about your most commonly asked questions around the COVID-19 vaccines. I'd like to welcome our first guest, Dr. J.P. Vallon. Dr. Vallon is the Executive Vice President and Chief Clinical Officer for SCL Health and provides leadership for all of our clinical activities. Welcome, Dr. Vallon.
Thank you, Megan. So excited to be here and talk about the COVID vaccine tonight.
Great. I'm going to kick it off with our first question. What COVID-19 vaccines are currently available?
Thanks, Megan. Great news is that the Pfizer-BioNTech vaccine was approved by the FDA on December 11th. And actually, the first doses got to Colorado and were administered here on the 14th of December. And actually, in the first week of their being available, SCL Health has administered over 3,000 of the Pfizer vaccine for COVID-19.
Oh, that's great. Who specifically is eligible for the vaccine today?
You know, Megan, we went through a very thoughtful process and collaborated with the CDC, as well as state and local authorities to prioritize who could get the vaccine. Our primary focus was to go and protect those who are at the highest risk of getting COVID-19 or being exposed. And that group today is our healthcare workers, our frontline healthcare workers who are caring for COVID patients in our hospitals, in our intensive care units, in our emergency departments. They come into contact with patients that we know have COVID every day. And so we want to protect them, and we're administering the vaccine to them first. There's a very thoughtful process about how to then prioritize after those healthcare workers and those healthcare heroes are protected. The next group would be those who also come into contact with COVID patients, other healthcare workers, as well as first responders like EMS, police, and fire. And then we're continuing to move down those who are involved in critical industries. We'll look at folks who work in schools, in education, as well as critical industries to make sure that they are safe. As those individuals all get vaccinated, we'll move to those who are most vulnerable and at highest risk of complications for COVID. That will likely focus on folks who are older than 60 or 65, those with significant medical conditions that put them at higher risk of having severe COVID disease. We hope to be getting to those individuals by January, late January into February. And then once those who are most at risk and most vulnerable are vaccinated, it will move into a broader general population, those who don't have significant health conditions and are part of the general population. We're excited, and we think it's incredibly important that everybody get vaccinated. And when they have the opportunity, we're really recommending that as many people get vaccinated as possible so we can end this pandemic.
Thank you, Dr. Vallon. I think one of the biggest questions on everyone's mind is the vaccine safe, and how do we know?
That's a great question, and I think it is top of mind for everybody, including those who evaluate it. It's important to remember that vaccines, any vaccine and any medication or drug is rigorously tested before it becomes approved and comes out to the public. The vaccines that have become available and will become available go through a rigorous process, 3 phases of testing through a study, and then they are evaluated. The results of that are evaluated by an independent panel of experts who then make a recommendation to the Food and Drug Administration about approving that and making that available. We know that all immunizations and shots can oftentimes cause minor symptoms afterwards, things like potentially a low-grade fever, some muscle aches, some ache at the site of the injection, headache, those types of things, and that's common with any vaccine that could happen. We do know that there is a slight risk of severe reaction, and those have been reported in the news, and you may have seen those in the news both in the United States as well as in Europe. They're extremely rare, those reactions. And that's why we ask people when we vaccinate them with COVID-19 vaccine to stay with us so that we can monitor you for at least 15 minutes after the vaccination, so that if any type of an adverse reaction were to occur, we would be there, you would be with us in a safe place to be able to respond to that. Those reactions are exceedingly low and exceedingly rare. And so overall, we believe that the vaccine is very safe. And when we consider what the risk is of COVID and the risk of significant disease and people really being debilitated or potentially dying from COVID, we think this is an incredibly important vaccine to get.
Great, thank you for that. Now moving on, how effective are the vaccines?
Thanks, Megan. What we know right now is the vaccines appear to be extremely effective. About 95% effective is what we have seen in the early studies and trials. But it is important to recognize that to achieve that level of effectiveness, you need to get 2 doses of at least the Pfizer vaccine as well as another one that is being approved, the Moderna vaccine. It's important to get those doses at the time interval, either 21 or 28 days later. And then after you've had two doses, then it's important to continue to wear masks and social distance, because we want to make sure that everybody continues to stay safe and safe from COVID and getting COVID in keeping our communities safe.
Great. And if someone should get the Pfizer vaccine, do they need to get that same Pfizer vaccine for their second dose?
Absolutely. The vaccines are not interchangeable. So if you get the Pfizer vaccine as your first vaccine, then the Pfizer vaccine would be your second vaccine. It's also incredibly important to make sure you get it in the right time frame. The Pfizer vaccine, the second dose should be administered 21 days after the first dose. There's a little bit of a window of a couple of days on either side of 21 days, but it's important for people to get that vaccine and get the second dose of the same vaccine.
Great. And knowing, Dr. Vallon, that this information is coming in daily, what's the best advice for people who have questions about the vaccine? Where can they go to get the answers they need?
That's a great question, and you're right. The information is continually coming in. It's changing on a daily basis. The place that gives you the most accurate and best information and is continuously updated is the CDC website. And so we would recommend you go to the CDC website, www.cdc.gov/vaccines, and they have the best information and the most current and up-to-date information on the current COVID vaccine that's been approved, and any new vaccines as they become available, they will have that information.
Dr. Vallon, thank you. And we'll ask that you stick around for some closing comments at the end. Now I'd like to go to Dr. Christy Chaudhry, who is an internist at St. Joseph Hospital. Welcome, Dr. Chaudhry. Thanks for joining us.
My pleasure.
The first coming in was, I was exposed to COVID-19 recently. Should I get the vaccine?
Right. Great question. I think the most important part to remember is if you've been exposed, you need to quarantine, because the people who might be giving you the vaccine and the people you would pass on the way in could be at risk. So make sure you still follow quarantine recommendations. But after that, the studies have shown that you can receive a much greater chance at immunity from receiving the vaccine. So we do still recommend that people proceed with the vaccine once it's available to them, even if they've been exposed.
Great, thank you, Dr. Chaudhry. The next question coming in is, what if I develop a fever after receiving the vaccine?
Everybody's biggest worry. It actually is a fairly small percentage. So after the first dose, very small, and after the second, as much as maybe 10% of people can have a fever. The thing to remember is a fever is a marker that your immune system is actually working, which we want it to do. That's how you develop immunity from the vaccine and prevent yourself from catching a severe COVID infection in the future. So it is really a good idea to let your body fight and build its immunity. If you can manage not to take something, hydrate, rest, and just let the fever run its course and let your body develop its immunity, you'll be better off. If your fever becomes severe or you have other symptoms that are prolonged or last for a great period of time, or a fever that's very high, you should contact a doctor.
Okay, thank you, Dr. Chaudhry. The next question that we've been asked by several, can I get COVID-19 by taking the vaccine?
No. So it's a simple answer. The vaccine is made from a very small, specific part of the virus, the spike protein. It is not made from the full virus. There is no real live virus in it. There is absolutely no chance that you can catch COVID from a vaccine, any of the ones that are being studied or on the market now. Remember, you can get a fever. You can get muscle aches, as Dr. Vallon mentioned. Those are markers that your immune system is responding to the vaccine as it should. It doesn't represent an illness. It represents your body developing immunity. And that's a really good thing. You can also be exposed to COVID before you develop immunity. So remember that it is possible that those two things can happen together, since so many people are contagious with the vaccine right now. So stick with it. You can't catch COVID from a vaccine.
Great, and that leads into the next question. If I receive the COVID-19 vaccine, when will I be protected by it?
There's partial immunity from just a few days after the first dose, but the complete immunity develops after the second dose. Really important to follow through and get both doses at the interval that you were instructed. With the Pfizer-BioNTech vaccine, it's a 21-day interval. 7 days after that second dose, so a month from when you start this process, people show a measurable amount of neutralizing antibodies, immunity in the bloodstream.
Great, thank you for that. And our last question is, are there people with certain conditions or on certain medications who should not get the vaccine? For example, is it safe to take while pregnant or breastfeeding?
Right. The first thing is these vaccines have been shown to be safe, largely in all of the early trials. But it's early on, and rare reactions can happen. Again, as Dr. Vallon already mentioned, if you have an unusual condition and you're thinking of the vaccine, discuss it with your physician for certain. The American College of Obstetrics and Gynecology has weighed in to say that although it's early and people who are pregnant or breastfeeding have never been formally or officially studied, there is early signs that it may be safe for pregnant women to take this vaccine, and they do not want it to be withheld from people who are pregnant or breastfeeding. So you just have to have a conversation with your physician. It is a safe vaccine, and in many cases much safer than catching the virus itself. So certainly speak to your doctor if you have concerns. But remember, people with comorbid conditions, illnesses, medical problems are the ones at the highest risk to have a severe infection. And so those are the people who should very thoughtfully consider and get the vaccine, because the protection for them would be much greater than it could be for people who might only have an asymptomatic infection. The other piece is, remember that we're trying very hard as a system and as a hospital to serve everyone. SEL Health feels really strongly about that, and I know other hospitals do too. We want to make sure that everyone has an equal and fair chance to get the vaccine, especially given that sometimes they have to be kept cold and frozen. So it's really important to talk to your doctor and then sign up when you get the chance.
Great. Our next guest I'd like to welcome is Amy Mannix, who's a registered nurse at St. Joseph Hospital. Amy, thank you, and thank you for being with us tonight. My first question to you is, as a frontline worker, how does it feel to see that the vaccinations are underway?
It's extraordinary. I think in the healthcare system, a lot of us thought that the chances of having a vaccine in the near future were distant, right? We know that early on, we just didn't know a lot about the virus. We didn't know how it reacted to different treatments and therapies. So the thought that we could get this far this quickly is phenomenal. It's something we've all been desperate to have and really excited for. So we're ecstatic and really just thrilled that it's underway.
And why do you think the COVID-19 vaccination is so important?
You know, all of 2019 has really been this extended period of trauma that we're all going through. And it's great that we're all in it together, but it's really hard to get up and face it every single day. Healthcare workers are tired, and we're anxious for this to be over. The hardest part is, I know I could go to my team and say, you know, another few weeks or months and we're through this, just, you know, stick with it and rally together. But that's the hardest thing, is there is no timeline, and we can't say this will all be over in a certain amount of time. So having the vaccine, while it's not going to change things tomorrow or next week, it's the start of that, right? It's the start of that hope and that understanding that this will get better. The healthcare workers and in the ER where I work, it's, you know, we're used to emergencies and taking care of critical patients, but this is entirely different. It's these young, healthy people coming on that we're having to intubate, and the isolation, their family members can't be there. And it's just devastating emotionally and physically draining with all the PPE and things to keep us safe. So having this vaccine available to us is at least the start of that hope, and knowing that we are going to come to a corner around this and it will get better.
What kind of questions and reactions are you getting from patients?
The patients are really excited to hear that we're doing it. I think the general public is also in shock that we have a vaccine this early. A lot of them are really asking questions about when they think it'll be available for the public, but also asking us as healthcare professionals, what do we think about the vaccine? Do we think it's safe? Are we going to get it? Would you want your family member getting it? That sort of thing. So, we've all gotten lots of great information from the system and other sources. So we feel educated enough to tell our patients everything that we know shows that it's really safe, and this is a wonderful advancement in our times, and to really be encouraged by it. So a lot of questions around if we feel it's safe, if we're going to get it, and timeline when they think the public will be able to have it.
Let's bring Dr. Vallon for a few closing comments. Dr. Vallon?
Thanks, Megan. Hopefully everybody got the sense that this is such an amazing time that we're in. It is a bit of a minor miracle of healthcare, of science, of biotech that we have a vaccine available. And I really love what Amy said, which is that this is the start of hope. We're not out of the woods yet, but this is a great time as we go forward. I'd love, as a final takeaway for folks, to share. You heard a lot about the vaccine today, and we continue to learn more every day about this vaccine and the new vaccines and that are available. I would encourage all of you, as you start to think about your personal situation and getting a vaccine, to work with your doctor, your primary care doctor. And if you don't have a primary care doctor, now is a great time to get a primary care doctor. They can help you with navigating when to get a vaccine and whether or not you have a condition which would put you at higher risk and to get a vaccine earlier than others. So that's an important piece. The other piece that I would say is we're here for you. As information comes out, we are available. We will continue to give you updates as to what's happening with the vaccine and share important information as we go forward. And finally, my ask for all of you is you've done such a great job in the public and in the community with masking, with social distancing, and helping to keep us all safe and keep our community safe and stop the spread of COVID-19. As much of this as being the start of hope, we need to continue to do those important things that will keep us all safe and keep our community safe as we continue to move forward and get everybody vaccinated. I really want to thank everybody tonight. I want to thank you, Megan, for everything you're doing to help us.
Thank you, Dr. Vallon. And thank you for joining us. I encourage you to check the social and digital channels of SEL Health for the latest information on COVID-19. The reality of the COVID vaccines brings light to what was becoming a very dark winter, but we're not done yet. Although the vaccines are a shining example of hope that the pandemic is nearing the end, we must remain vigilant when it comes to the COVID precautions and behaviors. Again, I want to thank everyone on behalf of SEL Health. Thank you again for joining us.